It will just be for about 20-30 minutes. I'm also going to start the recording now to the cloud, and this is for SET students, so you guys can watch again. Here we go. All right, so this is OET Speaking. We're at the start of a new week, and what we normally do in the first class on Monday is a kind of input session where you guys are not going to be doing lots of speaking today. We're just trying to understand, what does OET want? What do they want to hear from us? What kind of phrases should we say and when? Okay, then tomorrow, Wednesday, Thursday, Friday, that is when you guys will be practicing these phrases and techniques. First thing we want to do, though, is make sure that everyone can see the screen. Can everyone see this here?
Yes.
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 And we'll start off with a quick game, a speaking game. Rima, can you say hello? It's all right.
Hello.
Can you be my patient?
Okay.
Okay, so the patient is Rima, guys. I am going to be the doctor. Okay, very simple game. We're just going to have a short dialogue. You guys tell me, what mistake does Alan make? So find the error. Rima, let's just say that you have a headache. That's okay?
Okay.
All right, and guys, listen to this. Here we go. 3, 2, 1, go. Hi, Rima. Nice to see you again. What brings you here today?
Actually, doctor, I have a terrible headache for 2 days.
Okay, well, I'm sorry to hear that. Can you tell me a bit more about your symptoms?
I have noticed that my headache, after headache, I have a vomiting, and actually in my left side, I have noticed the headache.
Okay. Is this affecting your sleeping? And are you taking any
Yes.
pills?
Yeah, doctor. I cannot sleep very well.
Stop there. Now, Bensu, can you say hello, Bensu? I know some of you might know this
Hello.
already. What was my error there? Did you hear me make an error?
I'm not sure.
Okay, let me try a few other people before I say everyone. Lanky, can you say hello? Layla, Jasmine, what was my error here? It's a very clear one. Let's try some people. Put your hand up if you know the answer then. So Shashi,
I didn't hear.
Shashi, can you say hello?
Yeah, hello.
What was my error there?
Throughout the conversation, you were in a little hurry to ask questions.
Maybe I was in a bit of a hurry.
No empathy, sir. Empathy. No,
Empathy.
Okay, maybe I could have done more. I did do some. I did do the first one. I did say I'm sorry to hear that. There was a very clear error, though. But those are kind of smaller errors. Maybe they are errors. You're right. Naz, did you hear the clear?
Hi, Alan.
Yeah.
I think there was a compound question.
Thank you. So, guys, look, maybe too fast. That could be maybe more empathy was needed here. But the main one was a compound. Farouk, what is a compound question? Because not everyone...
Compound questions, it's a question you just ask 2 or 3 things together, and yeah, more than 2 questions.
Yeah, two questions together. Rima, do you remember the 2 questions that I asked you? Does anyone remember what I said?
Is this
affecting your sleep?
Taking blah blah.
And painkillers, right? So I said, is this affecting your sleep? And are you taking any painkillers?
Painkiller.
Right. OET do not like this. This is called a compound question. You should not ask 2 questions at the same time. Bensu, why is it a bad idea to ask 2 questions together? Why does OET not like that? What do you think, Bensu?
I don't know. Maybe it might be confusing for the patient.
You know it's confusing. And also, any other reasons why, guys, 2 questions is bad?
You can't get the right answers. Maybe the patient can answer only one question. Then you can miss the situation or condition he has.
Yeah, so you only get one answer. And Bensu, I think it can be confusing for a patient to get 2 or 3 questions at the same time. Okay, so guys, that was just a game. Today we're looking at OET speaking though, all right? And the plan for today's class is this. We'll start off with a quick review of the criteria. Then I'm going to be giving you some examples, and I want you to listen and identify what is Alan doing, okay? And then at the end of the class, we'll talk about this question, how much B1? This is the most important thing that you need to think about in your exam, okay? Now, before we start, has anyone never done OET before? Say hello or put your hand up if this is kind of your first time of doing OET. Maybe you don't know a lot about it.
Yeah, it's my first time.
BB. Okay, fantastic. So there are a few. So we do need to just quickly review the criteria. So I know that a lot of you know this already, but maybe people who know this already, you guys can help to teach the other students. Okay, so I'll use you guys to teach the other students. Okay, let's start with, I think BB would be good. Could you say hello, BB?
Hello.
Now, you're not new to OET, are you?
I haven't done the exam yet. I have been studying for 3 months.
Okay, so you know what's going on, I think. So BB,
Yeah.
tell me, what does this mean, criteria? Let's start with that. What does criteria mean?
Criteria, the rules and the rules,
rules.
yeah, and the OET accept what should be done and what should not be done during this.
So what do we think, guys? Is that right? Rules, criteria, rules, should do, should not do. Is she right, guys?
Cool. Yes, almost.
Yes.
Almost, Fareed, exactly.
Like a
Criteria
scoring system.
is a scoring system. Thank you. Who said that?
Me, Naz.
So Naz, we're talking about scoring, right? You nurses, you doctors, you have something called a pain criteria, right? And you are scoring the patient's pain. Well, it's the same here. Your speaking is being scored. Numbers are being given. Okay, so BB, how many criteria are there? How many sets? Or Charles, maybe you can help us here, Charles. Tatiana, how many criteria are there in OET? Just you 3?
We have 2 major criteria. 2 major criteria.
Yeah, so there's 2 sets of criteria. There's 2, okay? And Charles, I'm going to show you the first one. Maybe you can tell me what this one is, okay? Here is the first criteria. I'm going to zoom out my screen. What do we call this one, Charles? Just Charles, please. We could have
linguistic and criteria.
You can see the title, can't you? Of course, it's the linguistic criteria. What percentage of your grade comes from this? Everyone, what percentage of the grade is?
60%.
60%. 60.
So 60% of the grade, the OET speaking grade, is coming from here. We have things like fluency, appropriateness of language, grammar, intelligibility. Okay, that's the first criteria. What's the name of the second criteria, everyone? What's the name of the second criteria?
Clinical communication.
Fantastic. Now, Rima, what percentage of your grade comes from?
40.
40%, of course. Okay. What are we studying today, guys? Are we studying the clinical communication criteria or are we studying the linguistic? Everyone.
Clinical communication.
It's the clinical, okay. And Steph, Surya, can you guys say hello?
Hello.
Which one here are we studying today? The first one, second one, third one, fourth one.
Incorporation.
IPP. Is it A, B, C, D, or E?
B.
It's B, isn't it? It's this one, guys. So we're looking at this today. It's interesting to think about your scoring now. What is the maximum score? Maria, Cinder, what is the maximum score I can get here?
3.
3.
Yes.
It's not very big, is it, guys? You're going to get 0, which is very bad. You get 1, not really good enough. 2 or 3. I think every SET student can get a 3. All of you. Even if you don't think you're good at speaking. You can get a 3 in this. If you listen to us this week, just focus on what SET teachers tell you. I promise you can get a 3. We have a very high speaking pass rate in the school. Okay, so we're going to look at this in more detail. We're going to look at incorporating the patient's perspective. And I would like Pubadini. Can you help us here, Pubadini? Put your microphone on. Or Mary? Krishna? Could you guys say hello?
Hello.
Hello there.
Hello.
Okay. Pubadini.
Yes.
Okay. I want you just to let's just focus on just B1 here. Okay, B1. So this is understanding and incorporating the patient's perspective. Forget about it. It doesn't even matter what that means. What matters really is this, B1. Pubadini, can you read this?
Yes. Eliciting and exploring the patient's ideas, concerns, expectations.
Okay, so eliciting and exploring the patient's ideas, concerns, expectations. Put your hand up if you can make this more simple. Can anyone here summarize B1? What is B1 in a simple way? Put your hand up first. Insi, what does this mean, eliciting? What does it mean? What are we doing here? Insi? She put her hand up, but she's not speaking. We'll try.
I'm sorry, I didn't understand, and I'm here, teacher.
Oh, it's okay. I'll ask. It's no problem. I'll ask Priya though, because I think she's wants to answer this. Priya, you want to put your microphone on? You see, guys, just to remind you, you know what I'm going to do now, just to remind you all, this is why every class I always say this. If you cannot speak today, please let us know. Because now we're all looking at our watches and thinking, I've got a busy day today. Why are we waiting for Priya? Why are we waiting for these people? Okay. Please, guys, just let us know at the start, and then you don't have to talk if you don't want to talk. Charles, could you say hello? If it's okay, sir.
Hello. Hello.
Charles, can we make this more simple? Eliciting and exploring the patient's ideas. What does that mean? What does that actually mean?
Eliciting simply means asking about the patient's idea, concern, and expectation.
Asking. Right? So asking about, guys, what does this mean? Ideas, concerns, expectations. Everyone, what does that mean? Put it into one word. One word.
Feeling.
Yeah, let's say feelings.
Perspective.
Maybe opinion as well. So you're just asking them for their ideas and opinions. That's it. That's B1. Quick example of this. Rima, could you give us an example of this if you put your microphone on? Or maybe we could try Najibullah. Quick example.
How are you?
Go on.
How are you feeling at the moment?
How are you feeling at the moment? There you go. We could say that. We might say also, could you tell me a bit more about
your concern?
Yeah. Guys, you might say, why do you think you are having these symptoms? That's a B1 question. Okay. Asking about feelings and opinions. Okay. Aisha, could you say hello, Aisha?
Hello.
So Aisha, can you read this second one for me? What does this second one say?
Picking up the quiz. I think it's related to maybe patients say before some things make me feel worried.
Yeah.
We should ask the patient what's worrying you.
Yeah. So I agree. So when we say picking up, Aisha, what does that mean, picking up?
Asking question.
It's not just asking. It can be asking. Anyone? It's not asking.
Yes, responding to the sign of the patient shows.
Responding.
Gathering information. Observe the patient, maybe.
To pick up, guys, is to respond, to notice. Right? So if you see the patient, what is Q? Can anyone tell me? This is Q, Aisha.
Patient's answer,
Signs,
or response.
Body language from the patient body language.
Signs, responding to signs. It can be language signs, or it could be, let's just say, responding to signs. That's
Like
So they might say, Fareed, language signs might be, oh dear, right? Or, oh no, right? Or, oh really? What do those mean, those words? If I say, oh dear, what would that be?
Concerning.
It means maybe I'm worried, right? Or what if I
anxious?
What if I say, really? What does that mean?
So surprising, anxious.
Maybe they're surprised. Or what if they just go, what if it's not language and they just say,
Patient is worried.
anything like that, we need to respond. We need to respond to those signs, okay? And Aisha, we do need to say things like, are you okay? Right? Or can anyone give me, what can I say? What should I say when I notice it? I see
Is that problem for you?
Yeah, are you okay? Is that a problem?
Yeah.
Is everything
okay? You seem so
Is everything
anxious.
okay?
Is that a problem for
Yeah,
you?
is everything okay? You seem anxious. All of these things, guys, we need to practice them this week if the patient is showing the sign. Okay, the signs of distress or something. Okay, Michelle, I don't know if you're available today, Michelle, or if we could have, how about Elif or Berak, are you available today? I think no. Insi, if you can come back, one of you guys.
Yes, I'm here, teacher.
Insi, can you read number 3? What does it say, number 3?
Okay, I'm reading. Related explanation to elicit ideas, concerns, expectations.
Okay, pronunciation here is, guys, can we help her?
Elicited.
Elicited.
And before Aisha, pronunciation Aisha is cues. So everyone, 1, 2, 3, cues.
Cues.
Elicited.
Elicited.
Eliciting.
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 The noun form.
Now, don't worry about this language. Eliciting is asking. Okay, don't worry. Don't worry about this too much.
Ellen, there are second Q also. QUE. Please stand in the queue. That
It's
is
the
Q
same
also.
pronunciation but different meaning. Yeah. So QUE. I don't want to go into it, but there's different words, guys. There's
Making a line in a supermarket.
Q, and there's Q. Yeah, and there's Q. So a queue is a line in a supermarket. Yeah. Right. But what is a queue in this sense with a C, guys? What is that?
Sign.
It's a sign.
Fine.
Sign. Okay. All right. Now B3, Fareed, Hussein, you guys, what does it mean, B3? Can you make it more simple for us? Fareed and Hussein will be perfect.
Hussein, please. Then I.
Hussein, are you going to let him do that?
Yeah.
Put your hand up then, guys, if you think you can. Let's make this more simple today. Right?
When we are referring back to the ideas of the patient, when the patient says something, and we are echoing, yes, referring back it is right.
Referring back.
Yes.
And who else wants to say something here? Charles, Priya, Insi, what does it mean referring back to?
Relating it means just how to relate the science and her opinion.
Let's say, referring back to previous, right? Previous.
As you mentioned.
I think connecting, sir, better.
Yeah, we can say connecting back. Connecting back. Connecting back to
Explanation
previous
to the previous idea.
As you mentioned, you have headache.
Yeah. So guys, very often B1 is the thing that we should connect back to. Now, what does that mean, connect back? Aisha, could you tell us?
I think referring.
Okay, so
more proper,
referring. Well, let's go into this in more detail. So referring, can you give me an example, Aisha?
For example, earlier you mentioned that maybe we can say to patient, or you said earlier before. You said earlier just.
You said earlier you mentioned. Guys, that would be B3. Okay. Now, we're going to look at examples of this. I'm going to give you some examples of this. But I just want to say, for B3, should we do that at the start of the dialogue, in the middle, at the end? When do we do B3?
In the middle and the end.
Middle.
Middle or end? So
at the end.
Farouk, sometimes, Farouk, I've heard you try to do it at the start and it doesn't really work. You have to wait till, let's say they mention, I'm worried. You need to wait a little bit before you mention that again, okay, to get B3.
Okay.
I'll show you examples of this, okay? But does anyone have any questions so far? Put your hand up if you've got questions. Put them down if you don't have questions. Anyone got any questions on this? I think it's really simple. It's really clear. Okay, let me give you some examples. We're going to play a game. And the game is, I am going to speak. And you guys are going to tell me, is it B1, is it B2, or B3? Is that clear, everyone?
Yes.
Yes.
Yes. Alan will speak. You say B1, B2, or B3. Okay, remember B1 is asking about feelings, opinions. B2 is responding to signs. B3 is connecting back to previous ideas. Okay. All right, so here is the first one. I'm going to read this, and I want you guys to tell me what's happening. Then, okay, you can read it yourself. Okay, so here we go. I'm going to count down from 3. 3, 2, 1, go. Okay, so this is the point where you need to inject yourself. Now, you said earlier that you don't like needles, so try not to worry here. It really isn't a needle. It's more like a prick.
B3.
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 And Layla, you said B3. Why did you say B3? What is B3, Layla?
As you mentioned before.
Yes, which Rima mentioned. Now, as you mentioned before, you have to do this injection, this and that.
Did I say as you mentioned before? Is that what I said?
Yeah.
Earlier.
You said. But you concluded something. That's why I heard
B2. It was B2, I think.
It is B3, but I didn't say
B3.
that. Look and see what I said. Okay, so Layla, what did I say? Now you can see.
Okay, so the first thing you need to do is you need to clean the needle like this, and then and I hope you don't mind me saying, but you seem a little bit stressed when I mentioned this is the was I mentioned the needles.
And what about the stress, sir? It's too.
I think I read the wrong one here. Sorry, I read the wrong one, guys. It's my fault. Anyway, look, let's look at this, and we'll say, is this B1, B2, or B3? This one, guys. Is this B1, B2, or B3?
B3.
I think
B2, I
think. B2 and 3.
This is actually B2. This is B2. So I'm sorry, I've read the wrong one, Layla. So we'll look at your one in a minute. This one is B2. What is B2, guys? What did we say B2 is?
Is that okay?
Picking the cues.
Responding to
the sign.
Signs. Okay. So this is responding to signs. And how do I do that here? What language do I use to respond? What do I say? I say, is that okay? Do I say anything else?
Yes.
Is everything all right?
You seem a little bit stressed.
I say, is everything all right? I say, you seem a little bit stressed, Farouk, right? Where do I say that, guys? You seem a bit stressed.
In the middle here.
B2.
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 Seemed a bit stressed when I mentioned the needles. Okay. Also, what do I say before that, Charles? Before I say you seem stressed, I say, I hope you don't mind. So what is this, guys? I hope you don't mind me saying. What does that
Asking
mean?
the question if he is ready
Permission.
to
Ask permission.
Permission. It's being polite, right? You need to be careful, guys. With B2, guys, we need to be very careful not to, if I say, you seem stressed, that can be a bit rude, right? You need to say something like, I hope you don't mind me saying, or I'm sorry, but, okay? So this is being polite here.
And not judgmental, sir.
You're not judgmental. Then I'm saying here, this is, you seem a bit stressed. So what am I doing here? You seem a bit stressed.
Referring the situation because you can
responding the signs of the
By
patient.
referring to her feeling, right?
Yes.
What am I doing in the blue and the green, guys? What am I doing?
Confirming is
Checking, understand.
everything all right.
I'm not checking understanding, am I?
Eliciting if it is right or not.
I'm checking it's okay, right? I'm asking, right? So you can do all of these things, guys. All of these things can be done for B2. Write them down if you want. Take a photograph. This week, you can practice this yourself. It's not that difficult, okay? What I really like in this example is, I hope you don't mind me saying. Farouk, have you heard that one before? I hope you don't mind me saying.
Yeah, so.
I hope you don't mind me saying is a very good phrase, guys. You should all try to use this. It's very natural sounding, okay? All right, so let me do this again, and I'll try and get it right this time with the audio. I'm going to do the same thing again. Well, I want you guys to tell me, what am I doing? B1, B2, or B3? Is everyone ready? I promise it won't be wrong this time, okay? And Layla, you can do this one. Ready? So here we go. 3, 2, 1. Guys, listen. Hi there, my name is Alan, and I'm one of the nurses in your local GP clinic, and I'm just here. Can I confirm your name, please? Okay, great. May I call you Jane? Fantastic. So, Jane, how are you feeling today? Can you tell me a bit more about that? Okay, why do you think you are experiencing those symptoms? What am I doing, guys?
B1.
What is B1? What is B1?
B1 is eliciting.
How are you?
How are you feeling?
Asking, find out.
What is B3 again, guys? What is B3? B3 is...
B3 is
Referring
connection back to brain.
between
Bonding.
Connecting back.
Back to
Previous. And what is B2?
Pick up the patient.
Responding.
Responding to sign.
Okay, so we think this is B1. Does everyone agree I just did B1?
Yes.
Yes.
Okay. This is what I said, okay? Layla, where am I asking for feelings and opinions here? Where am I doing that?
Fantastic. So how are you feeling today?
So there's that one, of course. Anything else?
Why do you think that?
Yes. Can you tell me more about your condition or some situation?
Any more?
Yes, okay. Why do you think that you're this one?
So these kind of questions, guys, are the things we want to do at the start of our dialogue. This is B1.
One.
The first one, how are you feeling today? We almost always ask this, don't we, guys? Almost always ask this. Why? Can anyone tell me?
To start the conversation.
Open question.
It's an open question. It's good starting. And also, why? Why should we say, how are you feeling today?
Because we have to get the information from the patient.
You and the patient, sir.
We need to understand the feelings of patient.
Yeah, it's the feelings. It's more when we're talking, when we say how are you feeling, guys, it's more personal, right? Don't just get down to business straight away in OET speaking. Start with the personal side. How are you feeling today? Okay, so we almost always start with that. However, maybe I will need to ask another question, maybe even another one. Why? Elif, could you say hello, Elif or Aysun? Why do I need to maybe ask a second question? Why do I need to ask maybe even a third question? Bibi, Charles, Chandimali, why am I going any more?
The second question is an open-ended question because you need to get more detail, the detailed history about the complaint.
Why do I need to? Do I always need to ask a second question? Always a third? Do I always need?
No.
If it's not clear.
Depends on the patient.
Guys,
it's talkative.
It depends on the patient, guys, okay?
Yes.
Yes.
So, for example, Charles, maybe you say, how are you feeling today? And then they tell you everything. They tell you so much information. You don't really need any more. Then you don't need that. Okay? If they're blah, 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 blah. But maybe they say, how are you feeling today? I'm okay. Got a headache. Well, now we need more questions, right?
To find out the situation.
Can you tell me a bit more about that? Oh yeah, my headache is it's very bad and it happens at night. Oh, why do you think you are experiencing the headache? Okay. B1, guys, we'll talk about this later. You have to think about how much should I do? And it just depends. It depends on your patient. If your patient loves to talk, great. One question. If your patient is very shy, maybe depressed, maybe you need 4 questions, 3 questions. Okay. Is that clear, everyone?
Yes.
Yes.
And then the person you use the word ask this.
Yes. Sorry.
You ask personalize, I mean, the word
about 20, 30 minutes. Sorry about that. I asked to personalize it. Yeah.
Yes.
I think how are you feeling today is like, you know, I hate it when I'm talking to someone and they don't start with the personal. You don't want to start with it's business time straight away, right? You need to show that it's a human being. You want to ask them personally, okay? So I really think this is important. It's very important to ask that. Is there a situation where I would not ask this? Can anyone think of a situation where it's not good to ask how are you feeling?
Emergency.
Yeah, Fareed. Guys, if they just had a car crash and maybe someone has died, maybe you don't start like that.
And also a family of a patient.
Yeah. So it depends on context, but almost always we will start. Almost always we will start like this. Okay, one more. What's the last one? What did we do at the start? What did I miss?
B3.
It's B3. I'll do it again. Okay, I'm going to do it again. Ready? Listen to this. 3, 2, 1, go. Okay, so the first thing you need to do is you need to clean the needle like this, and then, is that okay? I hope you don't mind me saying the wrong one again. Start again.
One again, yeah.
Okay, so this is the point where you need to inject yourself. Now, you said earlier that you don't like needles, so try not to worry here. It really isn't a needle, it's more like a pinprick. Okay.
B3.
We know that it's B3, okay. B3 is connecting
Connecting
Okay. Now, let's look at what I said here. Okay, this is the point where you need to inject yourself. Now, you said earlier that you don't like needles, so try not to worry here. Now, Layla, if you can come back.
Yes, I can.
Where do I refer to the previous thing?
Now you said earlier that you don't like needles because she mentioned in previous conversation, yes.
Now, if I'm referring, guys, to like a previous worry, a previous dislike, what should I try and do as well?
Try not to worry, yes.
Reassurance.
Reassurance, okay? And so very often what you might do is that if you find out that they are worried about something, you can use reassurance here. Okay, so reassurance. We can also use phrases like, now you said earlier that. What else can we say, guys? You guys have other sentences. What else?
And also, isn't needle like it's small pinprick?
Yeah, so I'm trying to, that's a very specific situation. But guys, if you need to reassure them, tell them it's, you know, it's not so bad. But guys, I can say you said earlier. What else can I say? You said earlier that. I could say you said before that.
You mentioned that before.
You mentioned before that. What else?
Correct me if I'm wrong.
Oh, correct me if, well, you
That's
could use
good.
that one here.
As you said earlier.
I remember you saying.
Yeah, I remember you saying, as you said earlier, this is good. And Fareed, yeah, you could put this here. Correct me if I'm wrong, but you said earlier, right? That's a nice one. So guys, B3, we're connecting to previous comments and that kind of thing. Is it clear, everyone? Does it make sense?
Yes, yes.
Yeah.
So this week, we are going to try to practice doing things like this. All right. Now, here is a very, very important question. Rima would be good here, or Hussein. If you could say hello.
Hello.
Rima, do I need to do all of these things all the time? Am I always doing this, always doing this, always?
No.
Depends.
Well, Hussein, here's an interesting question. Which one do I usually do most?
First one,
The
B1.
first one, asking about feeling opinion.
So do this most cue cards. Does everyone agree?
Yes.
Yes.
Of course, how are you feeling today is most cards, okay?
Yes.
Responding to signs. Responding to signs?
Sometimes.
Okay.
Sometimes, not always. I think.
Yeah, it depends. On what? What are we waiting for?
Patient.
Patient response.
Yeah, only if they give signs, right? If there are no signs, you cannot respond to them. What about connecting to previous things?
If there has not been any visits.
Only, do I do this mostly? What do you guys think?
When
No, only needed.
No, if
Only
there's
when
something
needed.
not clear,
Only when needed, only when you have a previous thing to talk about. So if you're new to OET, often students get very stressed because they think that I am saying you must do these three things. No, you don't need to do these all the time. Only when needed. Okay. B1 is probably in your exam. It's probably only B1 that you can guarantee you will need this. Okay. Very, very good chance that you need B1. Okay. Now, does anyone have any questions? Put your hand up if you've got any questions. Insi, Priya, I don't know if you guys have any, or anyone. Is this clear?
I have a question, sir.
Thank you.
Go on. So let's have Insi first, then Farouk.
Yeah,
go on,
yeah.
Insi. Or Priya, was it? Who said thank you?
Thank you. I said thank you. I don't have a question. I need to practice. Yes.
No worries. Then Farouk.
Yep. Thank you, sir. As you mentioned earlier, like we do this one, some patients are talkative and use everything, not give you any point. Should we start from B3?
I don't, as I say, you can't start. What do you mean start from B3?
Yeah, for example, the patient said, I have this, and my feeling is like this. It's talkative. Can we say at one point that it's not clear? We start, as you mentioned, could you please tell me about your headache more? It means?
Yeah, you, as I said, you need to say this. I've noticed, Farouk, that you try and do this.
Yeah, because you would told me that I use this one, so I want to make it clear.
Yeah, because let me give an example, right? So this is what you sometimes do. You say, can you tell me more about that? And then the patient speaks, and then you say, okay, as you mentioned earlier. Now, earlier, what does earlier mean?
Before.
Before.
It doesn't mean like a moment, 1 moment ago. It doesn't mean that, right? It means like 3 minutes ago, right? So you cannot do it too soon.
Oh, yeah. Okay.
If you want to do it immediately, Farouk, you can say, as you just mentioned.
Just mentioned.
If you say earlier, it sounds really strange. That's it. So if you want to do it at the start, just say, as you just mentioned. Okay. Now, Guys, the biggest problem with B1 is how much? How much B1 should we do? What do you guys think? It depends, right? It depends. So let me give you an example. Let's look at this together, everyone together. I want you to read this and think about the question, how much B1? What is B1, guys? What is B1 again? Ask.
Explore the patient's
Feeling.
feelings.
Ask feeling.
Ask opinion.
Opinions. Okay, so in this case, what do you think, guys? Do I need a lot of B1 here? I'll give you 30 seconds, okay? Read this and think, okay, try and predict. Do I need a lot? Just read it and think about it. Is this the kind of situation where I'm going to ask 3 or 4 open questions or just one? How are you feeling today? Put your hand up if you can give me the answer. Just press the on Zoom, put your hand.
Patient card, Ellen.
One second. It's just the patient card, yeah, but just look at it. Look at the situation. Just look at the situation. Is this a situation where I'm going to be asking lots of B1 questions? Okay, everyone, what do you all think? Yes or no? A lot? 1?
Just one because of opinions.
I think here, does everyone agree with me? This would be just 1. Okay. Why only 1 question here? Why only 1?
Sorry. Because this patient one. Yeah.
Rima, go on, Rima.
For me, the first bullet point, you are happy to go into care.
Yeah, right. So, there you go. So
yeah,
happy to go into care. Okay. And also, what is he doing, guys? He's going into care for how long?
2 weeks.
2 weeks.
So does it make sense to be saying, how are you feeling? Oh, is everything okay? Oh, you're all right. Tell me more about your symptoms. There's no symptoms. There's no problem. Does that make sense?
Yes.
Now maybe it depends. Maybe he will say, you say, how are you feeling today? Maybe he says, yeah, I'm all right. In that case, okay, maybe we need to ask a second one. You know, tell me more about how you feel. But probably here we can already see, probably I don't need a lot. Okay, you can see it already in the cue cards. Let's have a look at another example. Okay, let's look at this. You've been asked to visit a 40-year-old patient at home by his GP. The patient was diagnosed with depression after losing the spouse and has been taking antidepressants. Greet the patient and find out how she's feeling. Find out if there is a trigger for the recent insomnia. What do we think, guys? Lots or nothing?
Lots.
Well, we have to be careful too.
It's easy. Well, don't you agree, Leila, that I'm going to be asking lots of IPP questions here?
Yes.
Probably. Okay. This one, he doesn't have a medical condition. He's just moving for 2 weeks. So probably I need 1 or 2. This one, you've got to be thinking, guys, okay, well, maybe I need to ask 2 or 3 here because there's lots of finding out, right? Lots of getting information. Look, ask for more information about. This will be lots of IPP, okay? What about this one now? Let's have a look at this together. I'll give you guys 30 seconds and just think, how much B1 do I need in a situation like this? How much B1? Put your hand up if you think you can tell me the answer when you're ready, okay? Just take a bit of time.